Hello everyone, we'll be taking you on the treatment of cough in children. What is cough? Cough is a reflex that helps clear the airway of secretion and protects the airway from foreign body aspiration. It can also be a manifesting symptom of a disease. Cough is one of the common complaints for which parents bring their children to healthcare practitioners. Who is a child? A child is an individual within the age range of 0 to 12 years. At this age, their metabolic system is still under development. Hence, when the healthcare practitioner comes up with treatment regimen, they should be cautious and take all factors into consideration. What are the common causes of cough in children? The common causes of cough in children include allergy, asthma, gastroesophageal reflux disease, environmental irritation.
So here are a few FDA safety guidelines as regards the treatment of cough in children. So for children under the ages of 2 years, there hasn't been any approved over-the-counter medications of cough in children. So you could try using honey for children between the ages of 1 to 2 years, because using over-the-counter medications for them could lead to potential side effects. Then for children above the ages of 2, then you should ensure you use recommended prescription by a medical doctor. And then generally, you ensure to practice proper hygiene, ensure adequate rest, and ensure maximum fluid intake. So, because stress could be a leading factor in the cause of cough. Thank you.
Everyone. So I'll be talking about the use of antipyretics and antihistamines in the treatment of cough in children. And usually, this cough is the body's response to the presence of allergens in the body. Antipyretics are usually used in the treatment of fever and headache, which are side-by-side responses to these allergens alongside cough. So some of the antipyretics we can use include paracetamol, naproxen, and ibuprofen. Then, talking about the antihistamines act by counteracting the effect of histamines. And these histamines are released once irritants get into the body, maybe through the mouth or through the nose. The antihistamines are classified into two generations: the first generation antihistamines and the second generation antihistamines. The first generation antihistamines include drugs like diphenhydramine and chlorpheniramine. And the second generation antihistamines. Now, the difference between the first generation antihistamines and the second generation antihistamines is that the first generation antihistamines have sedative effects. Therefore, anybody taking these drugs will not be able to perform all these activities that require using the brain very well, because you can feel sleepy, for example. But the second generation antihistamines do not have these sedative effects.
So, treatment of cough in children. I'll be speaking on decongestants, antitussives, expectorants, and antibiotics. Decongestants, for starters, are just cough medications that are used in cough that are a result of postnasal drip, and this postnasal drip usually occurs in infections and in case of cold. Now, decongestants that can be used include pseudoephedrine, oxymetazoline. Pseudoephedrine is usually contraindicated in children younger than the age of 6 and children with who are suffering from severe hypertension, which is rare, but is contraindicated in them and in renal impairments. Now, off to my next drug, I'll be speaking on antitussives. These are medications that increase the cough threshold in the CNS, primarily at the medulla, and thereby suppress coughing. Now, antitussives are of two kinds. You have the narcotic or opioid kind and the non-narcotic or non-opioid kind. These narcotic kind, which usually include codeine, are not necessarily used for children due to a lot of complications. Now, in the non-narcotics, you have dextromethorphan, which is very common in most cough medications. Dextromethorphan is usually contraindicated in children younger than the age of 4 and cannot be given alongside with an expectorant. That takes me to my next drug, expectorants. These are cough medications that increase mucus secretion and also make them easier to cough out. They can also be called mucolytics. A good example that can be seen in most cough medications, such as Mucinex, is guaifenesin. Guaifenesin is good in case where there is tenacious buildup of mucus in the airways, and it's hard to cough. So it hydrates the mucus and makes them easy to be coughed out. Contraindications of these mucinex and guaifenesin containing cough medications is that they have, just as they have the ability to loosen mucus in the airways, they also have the ability to loosen mucus in the GIT and the stomach lining, thereby increasing chances of stomach ulcers. My next drug will be antibiotics. Antibiotics, as we all know, are medications that we use to suppress bacterial infections or kill the bacteria that is responsible for those infections. And certain infections include pneumonia, bronchitis, whooping cough, and the likes. Now, cough that is usually as a symptom of those infections can be treated with an antibiotic, but the antibiotic is not targeting the cough but the infection. Now, as the antibiotic treats the infection, it can as well treat the cough. Antibiotics, on the other hand, are not the first line medications for treating cough in children per se, except when certain signs have been observed in them. And these signs could include cough that is lasting more than 14 weeks, or a cough that has been accompanied with a thick yellowy or greenish secretion or sputum. Side effects that can be seen in most cough medications, such as in decongestants. Decongestants, a precaution is that they cannot be used for too long, as they can result in rebound congestion. So they are very short-term medications. Now, another side effect can be seen in expectorants, where they loosen the mucus in the stomach lining, and also they are not good when administered together with antitussives, and this is as a result of antitussives having the ability to suppress coughing, and mucolytics or expectorants increasing mucus secretion, which needs to be coughed out. Now, and I think that will be my last point, but then at the end of the day, most cough medications for children need a physician's advice or an advice from a pharmacist.
Cough in children usually resolves itself after a week or two, so it is best advised to wait it out before the use of any form of medications. But here are a few home remedies that is suitable for the treatment of cough in children. It is advised to use fluids like warm water, warm milk, fruit juice in the treatment of cough in children, as it moistens their throats and relieves them of cough. You could also use saline nose drops or spray. This helps to clear the nasal airways from any form of foreign bodies that could stimulate the cough receptors. We could also use honey. Honey is a very, very efficient natural remedy. When dissolved in water and taken, it moistens the throat, relieving the children of cough. Thank you.
It is advisable to seek medical attention if the child shows any of the following symptoms: if there is severe or persistent cough lasting for more than 2 weeks, if there is labored or difficulty in breathing, if there is suspicion that the child must have taken any foreign substance is blocking the child airway passage. It's also advisable to take the child to see a medical practitioner if there is any case or instance of hemoptysis, which is coughing up of blood, and also if the child shows any signs of dehydration, chest pain, and unusual irritability. Thank you.
In conclusion, managing cough in children requires understanding its causes, such as infections, asthma, and allergies. Safety is crucial with appropriate dosing and awareness of side effects and FDA warnings. Pharmacological treatments, including analgesics, decongestants, antihistamines, and antitussives, should be used carefully. Thank you for watching.